There are 3 prescription medicines that are available in New Zealand for helping people quit smoking. These are Buproprion, Nortriptyline, and Varenicline. Now, although these are prescription-only medicines and people will need to see their GP to get hold of them, you have a role in providing some good, clear and simple information to your clients. All of these products work by alleviating symptoms of withdrawal, making quitting easier, and will at least double the chances of quitting long term. It's also important to remember that there are no magic cures for quitting smoking, and this is no exception with these particular products. Buproprion is an antidepressant type drug, which was found by chance to help people stop smoking. It works by primarily reducing the withdrawal symptoms associated with stopping smoking, thereby making quitting easier. It's relatively easy to use, but it needs to be started at least a week before the quit date. Therefore, it's really important that you help your client obtain this medicine well in advance of their quit date. When they receive the medicine, they should use it 1 tablet once a day for the first 3 days, thereafter 1 tablet twice a day. You need to keep at least 8 hours between each dose. There are some common side effects with this medicine. Headache, dry mouth, and difficulty sleeping are the most commonly experienced, but are usually mild to moderate, and most people can put up with these. There is a rare risk of seizure. Around about 1 in 1,000 people may experience a seizure. Although this is rare, I think it's important that you give this information to your patients. There are also a number of people that can't take this medicine. For example, anyone with a history of seizure or brain tumour or taking some other medications may not be able to use this drug. Your client's GP is the best person to decide on the suitability of this particular medicine. People should use this medicine for at least 7 weeks. Make sure people complete the course of treatment. Stopping too soon is associated with a risk of relapse. Also remember that this drug is no magic cure. It is effective, it does work, but there's still effort involved. Nortriptyline is another antidepressant medicine that works to help people stop smoking. Its mechanism of action is that it relieves withdrawal symptoms and makes quitting easier. This medicine also needs to be started prior to the quit date, so you need to help your client get an appointment and get the medicine in plenty of time before their designated quit date. The doctor will advise on how to use the medicine, but in general people start with a low dose, increasing over a few days to weeks. People should use this medicine for 12 weeks, and at the end of that 12-week treatment, they will probably reduce their dose as well. Like all medicines, Nortriptyline has some common side effects. The most common ones are dry mouth, sleepiness, and constipation. Advise your clients about these things. Most are mild to moderate, and most people won't have any problem with them. There are also some people that can't use Nortriptyline, for example, pregnant women or people that have had a recent heart attack. Varenicline was a medicine specifically designed to help people stop smoking. It works a little bit like nicotine, but doesn't quite have the same effect. If I can put it one way, if nicotine was like a 100-watt light bulb, then Varenicline's more of a 45-watt light bulb. It doesn't light up the brain, but it's enough to keep the person out of the dark. Varenicline works primarily by reducing withdrawal symptoms and urges to smoke, making quitting a little bit easier. However, it also reduces the reward associated with smoking. People may notice this when they first start taking the drug. They may not say, it's reduced my reward, but they might say things like, my cigarettes just don't taste the same. And that's fine, and actually may be a good sign. People need to start taking Varenicline prior to their quit date, at least a week before. So you need to help them get the medicine well in advance of their quit date. The dosage is very easy, and the instructions are on the packet. Essentially, people start with a low dose and increase to the full dose on their quit date. They should use the tablets for the full 12-week treatment course. There are some common side effects associated with this medicine. Nausea, insomnia, abnormal dreams are the most common. Nausea is quite well tolerated, but if people complain of severe nausea, check that they're taking it with food. That can really help. There's one other symptom that I'd like to mention, and that's mood changes, or depression in particular. Some people, when they've taken this medicine, have become quite severely depressed. It's important that you monitor your patients on Varenicline, and if you see any mood changes that appear worrying, please get them to see their doctor. You can advise them to stop the medicine in the meantime. Varenicline is an effective drug, but it's no magic cure, and it's really important to communicate that message. With these prescription medicines, you play a really important role in monitoring for side effects. Most of the side effects are going to be mild or moderate, nausea for example, or headache, or difficulty sleeping. However, occasionally you'll come across people that report more severe side effects. In these cases, it's really important that you get them to go back to their GP to deal with these. If in doubt, ask them to stop their medication and see their GP immediately. There's no evidence that using these prescription medicines with any of the other products increases long-term quit rates. So, reassure your clients that they will be okay in just using one of these products alone.